All right. Good afternoon, everyone. Thank you so much for joining us for today's virtual session. We have got Stephanie Turner with us through the South Carolina Department of Disabilities and Special Needs. She is going to be talking a little bit today about the services that are available through DDSN. A quick note, we are recording today's session, so you'll be able to go back and watch this on Family Connections YouTube channel. Once that gets posted, you'll be able to access it through a link that we'll send out. And Stephanie has also agreed to share a copy of her presentation and some other materials from today's training. So you'll get that in an email, in the email that you use to register for this session. A couple of quick housekeeping notes and I'll turn it over. We are going to take questions as part of this presentation. We're going to try to, Stephanie's got some time at the end, try to hold them all for the end, but you can go ahead at any point in the chat and ask your question and I'll go through and make sure we get to it as we go, as you know, get to it at the end. But again, if you've got the question, go ahead and put it in the chat so you don't forget and we can get to it at the end. And then I'll also be putting a link in the chat and we'll send it to you all in an email as well, our evaluation survey. And just thank you in advance for taking a minute to complete that. Give us your feedback so we can plan future trainings. And with that, Stephanie, I'm going to turn it over to you. Thanks.
Thank you so much, everyone. Thank you, Megan. Thank you, Family Connection, for giving me this opportunity. I'm going to share my screen with sound, hopefully correctly. Can you see my screen okay? All right. So my name is Stephanie Turner. I'm the Autism Division Director over here at the South Carolina Department of Disabilities and Special Needs, and I have the privilege of talking about this wonderful agency that I'm with. I recognize a couple of people on the participant or attendee list, so hey everybody, this might be a refresher for you, but it's always nice to see you guys. So today I am going to talk about a little bit about DDSN, some history, some supportive services that could be considered non-waiver services, a little bit about our waiver services, and then we're definitely going to make sure that you guys know how to apply and some of the other fun stuff we've been doing in the community lately. So to start, this is us. We took a nice, fun little picture in front of our agency a couple months ago when the sun was shining and it was a little bit warmer outside. So the South Carolina Department of Disabilities and Special Needs, we know today, was established with the name DDSN in 1993. It was formerly known as the Department of Mental Retardation, which was established in 1968. It did exist under a name before that, but it's relatively new as a state agency. DDSN strives to serve all South Carolinians who are eligible for services and to ensure that services meet high standards. The populations served by DDSN include individuals with intellectual disabilities, related disabilities to that, autism spectrum disorder, traumatic brain injury, traumatic spinal cord injury, and similar disabilities. And those would be disabilities affecting the brain or spinal cord, which are not associated with the process of a progressive degenerative illness or disease. Things like dementia or neurological disorders related to aging, they would not qualify for DDSN category. And then we also have a high-risk infant and at-risk child category. We did run some numbers just for you guys. So a little bit earlier, probably about mid-October, 53% of our individuals fell in our ID-RD category, so the intellectual disability and related disability category. 43% fell into our autism category, and about 4% fell under our head and spinal cord injury category. And when we looked at that by age, 17% fell in that 0 to 6-year-old age range. 32% were between the ages of 7 and 21, and 51% were 22 years of age and older. So the vast majority of our folks are adults. DDSN is designed to serve the adult population primarily. Now, DDSN delivers over 98% of its services in community settings, things like the DSN boards, which are quasi-governmental organizations or private service providers. It's important to note that your local DSN board, they're not staffed with DDSN employees. It's very confusing because we use like the same letters. And DDSN does not have authority over DSN boards. Services are available in every county in the state. And most of DDSN's waiver services are designed for adults because Medicaid covers the majority of services for children 0 to 21 or 0 to 18. I'd love to just share our vision and mission statement with you guys. So our vision is to provide the very best services to assist all persons with disabilities and their families in South Carolina, which is a very admirable vision statement. And the mission to assist people with disabilities and their families through choice and meeting needs, pursuing possibilities, and achieving life goals, and minimizing their occurrence and reduce the severity of disabilities through prevention. We are governed by a commission, which is pretty unique for us and for the nation. So DDSN is governed by a 7-member commission that's appointed by the governor with advice and consent of the Senate. And there is a commission member for each of the state's 7 congressional districts. And I'm going to give you their names just so you know who is your commission member. So commission meetings are open to the public and are usually held on the 3rd Thursday of every month at 10 a.m. and anyone can attend in person or virtually. And the link to attend those is available on DDSN website if you're interested. For District 1, which would be Beaufort, Berkeley, Charleston, Colleton, and Dorchester, that's going to be Barry Malfris as your commissioner. For District 2, which is Aiken, Barnwell, Lexington, Orangeburg, and Richland, Gary Coker is the commissioner. David Thomas is over Abbeville, Anderson, Edgefield, Greenville, Greenwood, Lawrence, McCormick, Newberry, Oconee, Pickens, and Saluda. We do have a vacancy for districts 4 and 7. Michelle Woodhead is over Cherokee, Chester, Fairfield, Kershaw, Lancaster, Lee, Newberry, Spartanburg, Sumter, Union, and York lot. Eddie Miller is over Allendale, Bamberg, Beaufort, Berkeley, Calhoun, Charleston, Clarendon, Colleton, Dorchester, Florence, Hampton, Jasper, Orangeburg, Richland, Sumter, and Williamsburg. He's got quite a lot in his catchment area. This information is readily available on our website if you're wondering who is the commissioner over your area of the state. Now, the state director of DDSN is selected and appointed by the commission. So again, the commissioners are appointed by the governor, and then my state director, Constance Holloway, is appointed by the commission. I would love to start by talking about our supportive services. So DDSN supports individuals by connecting them to necessary services. When a child has a disability and is Medicaid eligible, the most needed or medically necessary services are covered by Medicaid, and DDSN can offer some supportive services. Those would be, to start with, things like early intervention. So most people think of BabyNet when it comes to early intervention, but here at DDSN, we cover a version of early intervention for children who are ages 3 to 6. So sometimes what we find is families get early intervention from 0 to 3, and then it stops without knowing that it could have continued up until their 6th birthday in certain situations. So early intervention is a family-centered program that provides family training and service coordination, and it usually happens in the home. Again, 0 to 3 would be under BabyNet, and then DDSN would pick up the rest. After early intervention usually comes case management, and case management is key. It's less intensive than early intervention and focused primarily on referral and linkage. The case manager will assess the individual's needs, develop a plan to address those needs, and implement the plan, which may include referrals to needed services. If you think you have a case manager but don't know who it is, just give us a call, DDSN. I'll give you the number at the end, and we can get you that information for you or connect you with a new case manager provider. If you had a case manager in the past but no longer needed the service likely stopped. And if case management is again needed, you have to contact the case manager you used before or call DDSN to restart the service. And if you have a case manager now, you should be hearing from your assigned case manager at least every 60 days. If you're enrolled in one of the waivers, then your case manager should be contacting you every month. All good information to know. Hopefully you guys know that we've also partnered with Greenwood Genetic Center to offer genetic testing if you are DDSN eligible or the individual that you care for as DDSN eligible. So DDSN and Greenwood Genetics Center have worked together since 1974, which I think is amazing, to serve individuals with developmental delay, intellectual disabilities, autism, and birth defects. Genetic evaluations are available to all DDSN eligible individuals through GGC's, that's Greenwood Genetics Center's, statewide network of clinical offices. There's an easy online application process, but your individual case manager or early interventionist would need to make the referral. GGC will first bill your private insurance if you have it, then we'll bill Medicaid, and then they'll send the remainder to DDSN if there is any. The genetic information doesn't go into a big genetic database like other genetic testing services, and I know that's important information to know for some families. And then not all individuals referred for genetic evaluation will receive a blood test. If you're thinking your loved one is not good for that, sometimes it's just a saliva sample. But only those who the geneticist suspects may benefit from testing will receive a blood draw. Now, if the individual is referred to an outside lab for additional testing or other services, there may be a cost involved with that. Now, why would you get genetic testing? Knowing the reason a person has a disability can be helpful for many reasons. Some disabilities can affect a person's health as well as their learning, and there may be certain treatments that may benefit the individual because of their diagnosis. Referrals can be made to doctors who specialize in particular problems related to that diagnosis. So it's just a missing piece. We do offer individual and family support funds. So individual and family support is available to assist individuals and families who incur additional expenses due to the individual's disability. And some examples we've seen are a flotation device to make a pool safe for a child with cerebral palsy, or a pool alarm for a backyard pool for safety reasons. We also have family arranged respite services, which is a subcategory of the individual and family support funds. And through these, we provide temporary care to individuals, which allow families or caregivers to handle emergencies, personal situations, or just to take a break. The respite assessment will determine how much is paid and how many hours a family can receive. So that's unique to each family and application. And respite is only available to individuals served in the permanent eligibility category, meaning if the child qualified for DDSN eligibility in that at-risk infant or high-risk infant at-risk child category, it wouldn't be available for them. We also have summer support funds. These are also a subcategory of the individual and family support funds. These funds help children maintain skills throughout the summer, and these skills are part of goals in their plan written by the case manager or early interventionist. Examples include things like summer camp. We might not pay for all of the special needs summer camp, but maybe a portion of it. Swimming lessons, horseback riding, zoo tickets, not zoo membership, movie tickets, dance lessons. This would not be approved for things like additional respite, adaptive medical equipment, stuff like that. And this is also only available for those in a permanent eligibility category. Funding varies year to year, so it's not the same amount every year. I do get questions from time to time about our waiver services, as you can imagine. So the Home and Community-Based Services HCBS waiver program was established in 1981 and allowed states to elect to furnish under Medicaid as an alternative to institutional care, a broad array of services that are otherwise not covered under the Medicaid program. To put that more simply, a lot of our folks were institutionalized once upon a time, and as a state, South Carolina went to the federal Medicaid and was like, we would like a different route for those folks. And so the Home and Community-Based Services waivers were born. Now, Medicaid waivers maximize state dollars and allows them to go 3 times farther than if just state dollars were being used. I would think of waivers, conceptualize waivers, as a supplemental insurance. So Medicaid is a type of health insurance. And then you have things like long-term disability insurance, which is a supplemental insurance or additional coverage. And that's what a waiver service is. It's like an add-on. A waiver is a special or different program under Medicaid and is not available to all Medicaid recipients. We have 8 home and community-based waivers in South Carolina. I'm going to talk in more detail about the ones that DDSN manages, but I do just want to touch on the other ones as well, because we're not the only waivers in the game. So the PCSC waiver, which is managed by the Department of Children's Advocacy Continuum of Care, offers high fidelity wraparound, respite, and individual directed goods and services. The medically complex children's waiver offers registered nurse care coordination, respite, environmental modification, and pediatric medical daycare. The Community Choices Waiver offers an alternative option to nursing home residents by receiving assistive services at home rather than in institutional settings. We also have an HIV/AIDS waiver that serves individuals in South Carolina with the diagnosis of HIV or AIDS who meet at-risk of hospitalization level of care criteria. And there's also a mechanical ventilator dependent waiver that serves the frail elderly and persons with physical disabilities who require mechanical ventilation and meet the nursing facility level of care criteria. Regarding DDSN waivers, we've got 3. We've got the intellectual disability and related disability waiver, the community supports waiver, and the head and spinal cord injury waiver. And these 3 waivers serve approximately 12,000 individuals, 4,000 in a residential setting, and 8,000 at home with their families. So the vast majority of our folks are in the community with their loved ones. And residential doesn't mean DDSN residential, there's other options as well. So starting in 2018, once an individual is DDSN eligible and in a permanent eligibility category, they will be placed on the wait list for every waiver they qualify for. So for example, if somebody qualified under our autism category, we would put them in both the IDRD waiver wait list and the community supports wait list. We do that automatically. Once upon a time, before 2018, you had to elect to do that, but that's an automatic process now. Now, you can only be enrolled in one waiver at a time, but you can be on multiple wait lists. And each waiver offers several core services, things like case management, personal support, emergency response system, respite care, and additional services are available under each waiver that we'll talk about next. Participation is voluntary. Somebody could go through our DDSN eligibility process and say, no, I don't need a waiver, and they just get passed up on the list, go to the bottom, not a problem. There's also level of care requirements for each of our waivers. So just because somebody's DDSN eligible, there's still a level of care process associated with that. To be active on a waiver, a family has to use at least 2 services every 30 days. If they dip below that, then they'll likely be taken off that waiver so somebody else can have that slot. One of the services can be case management, which they need to have active case management to be on a waiver anyway. So it's a pretty low threshold for people to meet. We've also heard of individuals doing waiver hopping. So they might start on the community supports waiver, which has a shorter wait list, and then pop to the IDRD waiver as a slot becomes available. I'm going to start with the head and spinal cord injury waiver. We have a fact sheet on our website about that. If you want to learn all the services that are available, I just pulled out these 3 here. So some examples that I'd like to highlight is assistive technology, such as private vehicle modifications and environmental modifications like ramps, door openers, for example. We also have attendant care, where someone comes into the home to provide hands-on assistance with chores, bathing, and eating. And there's also nursing, where someone is there to handle skilled care tasks like wound treatment, assistance with bowel programs. That kind of stuff is pretty important in a household. We do have a small amount of children who are eligible for the HASKI waiver. So this isn't just an adult service. The community supports waiver is next. Again, I just pulled out these 4 services here to highlight. We offer through that waiver respite, which is relief for people who need a reprieve from giving care. It does not include bathing and toileting skills. There's employment services for individuals where they assess skills and help fill gaps to maintain employment, resume building, and job searching. We do have day programs where individuals who are 18 years of age or older go in the community to be around other people with similar life experiences. And we also have a combination of in-home supports that include things like personal care and respite, hands-on care with supervision. Our last waiver is the IDRD waiver, and it is the longest wait list of all the waivers. It includes things like incontinence supplies, diapers, underpads, wipes, liners, and disposable gloves for individuals who are 21 and older, day activity, which is activities and services to help people achieve, maintain, and improve the loss of personal care, social or adaptive skills, and adult day health care, which is a drop-off for those who are 18 years of age or older for about 5 hours or more a day, at least 1 day a week, and they've got health and social services there. There's also adult companion care, which would be an individual who's at least 18 years old working on therapeutic goals with the individual. This is a big question that I get is how do people apply for DDSN eligibility and our waivers? And I keep in mind these eligibility categories here. So I kind of shouted them out pretty quickly earlier, but these are our 7 eligibility categories. An individual would have to be domiciled in South Carolina and be confirmed by DDSN to meet the criteria for at least one of these categories listed. For intellectual disability, an individual needs to have records of development of the intellectual disability prior to the age of 22. This could be in the form of school records, evaluations, an IEP, special education classification, IQ test of 70 or lower is key, adaptive tests, and anecdotal information from the family. For our related disability category, these are things like cerebral palsy or Down syndrome, and we need documentation from medical records of the specific condition with an onset prior to the age of 22 and measures of adaptive behavior. And we can fill that in if you guys don't have that. For our high-risk infant at-risk child category, this would be documented developmental delay from an OT, occupational therapist, a physical therapist, or a speech therapist within the last 6 months. Could be school evaluations, an IEP if they have one because they're old enough to go to school, and genetic information. For autism, we'd like an existing definitive diagnosis of autism. Otherwise, we will complete our own autism evaluation. Special plug, we have no wait list for our Midlands and Upstate autism evaluation offices, so please keep that in mind if you're looking for an evaluation. And for head and spinal cord injury and similar disability, documentation of the injury, medical records pertinent to that injury, medical history, consultation related to the injury, and then medical tests such as CTs, MRIs, EEGs. We would also accept physical therapy, occupational therapy, or speech therapy evals and discharge summary. So things that caregivers likely already have on hand, or we could get from the school is in summary. Now to apply for the services, pretty easy. We got one door in. Call 1-800-289-7012. Now, this is staffed by real live people Monday through Friday, 8:30 to 5, not on state holidays. I would not advise calling at 4:59 on a Friday, so just keep that in mind. Now, when you call, please have the following information available for the applicant, about the applicant: the full name, date of birth, social security number if they have it, Medicaid number if they have it, you don't need that to apply, home address, phone number, email address if available. Plan to spend about 15 minutes on your call chatting through all this information, and you're going to be asked questions to establish your residency in South Carolina, and you're going to be asked questions to get general information about the disability so that the screeners can put you on the right track for intake. Is that intellectual disability? Is that head and spinal cord? Is that autism? Is that something else? So they are going to ask you some general questions about that. If you are applying for any other eligibility category but autism, you will be asked to select 3 intake service providers from a list that's read to you over the phone, and the intake provider will help you through the rest of the eligibility process at no cost to you, and DDSN will contact the intake service provider you choose. Eventually, you'll receive a letter from DDSN confirming your application for eligibility. The intake provider will contact you within 2 weeks and will provide you information and collect medical and educational records that are needed to evaluate for eligibility. Once the appropriate records are submitted to intake or to our autism eligibility coordinator, DDSN will notify the applicant in writing of their eligibility status. Autism is a little bit different because we evaluate that in-house with our records review and the whole autism intake team and our evaluators over there. So we'll eventually request records. If they have everything that we need, you'll eventually get a letter confirming eligibility. If it doesn't have everything that we need, then you'll likely be contacted to schedule an evaluation. Now, some of you might be asking today, how do I verify if I have eligibility? My child is 17, and I think I might have done something when they were 3. Just go ahead and call us. You can call the 1-800-289-7012 number and just ask if my child is already DDSN eligible. They'll ask you for some demographic information, be able to look that up. Again, that's staffed Monday through Friday, 8:30 to 5. Now, some of the fun stuff that I like to point out to people is DDSN is everywhere, but I also want to make sure that you guys haven't fallen asleep on me as we go through this presentation. So if you can give me, let's see what emojis we have. Either a T or an F for true or false in the chat when I ask you these questions, just to make sure you were paying attention throughout that. When you're thinking about DDSN waiver services, true or false, there are no limits to DDSN waiver services. We have unlimited funding with unlimited hours for everybody. Yeah, good job. Everyone's paying attention. All right. DDSN will help pay for respite so the caregiver can take a break. True or false? Yeah, true, true, true. Absolutely. DDSN supports individuals with high functioning autism. True or false? Yes, absolutely. We don't care about the level of severity when it comes to autism. 50% of DDSN individuals live in a residential facility. True or false? False. Vast majority of our folks live in the community. That's correct. Being a South Carolina resident is required for DDSN eligibility. True or false? Woo! Please live in South Carolina before applying for our state supportive services. This one's kind of tricky, so I'm going to emphasize it for you guys. A child with degenerative muscular dystrophy only can receive services from the Haskell division. True or false? Y'all are paying attention. Keyword was degenerative. We don't cover that. You guys are paying attention. Now, if they had a co-occurring intellectual disability, diagnosis of autism, or something like that, then we would pop them into that category and try to get them through. True or false? Anyone can attend the monthly commission meeting on the third Thursday at 10 a.m. That's usually on the third Thursday. You get what I'm saying. True. Please tune in. Please tune in. They're fun. Once a child enters public school, it is too late for DDSN services. True or false? False, not too late. But what we do find is families get the early intervention, then they get popped into the child find at their local school, and then families are like, I don't need any services right now. And maybe you don't need them right now, but I also think like your 4-year-old will be a 24-year-old one day, and we need to think about services for that. Let's go to DDSN waiver services are designed to support individuals to enable them to live in their community for as long as possible. True or false? True. That's right. And then another referral category that we get sometimes is a child with fetal alcohol spectrum disorder only can receive DDSN services. True or false? False. Right. If they had a co-occurring intellectual disability, absolutely, be free, have fun, or autism, I see that from time to time, please, please, please refer them to us. Other fun things that we're doing is holding a training Tuesdays for case managers. If any of you are case manager providers, if you're thinking, hey, my case manager should take advantage of that, from 10 a.m. until 12 on the second Tuesday of every month, we have different categories of trainings that we are putting on via Teams. So come on, come on. The other cool thing that we're doing, if you have a case manager or an early interventionist, this is behind the scenes. This is our internal system where we have folders of resource flyers and where we have over 80 flyers just popped in there that you can take advantage of by asking your case manager or EI for that information. We do community outreach as well. We're at places like Adventure, Segra Park, which is the minor league baseball team here in Columbia. We put together sensory kits for attendees for them. Spark in the Park, we attend every year. We are at the Disability Celebration Day at the State Museum and their Saturday sensory friendly events. I train law enforcement pretty regularly. And we're also having our holiday market. It's our 5th annual holiday market on December 5th, 2024, where individuals that are either self-employed and they have a disability, or they work with a disability agency and they make a craft of some sort, have a table and they sell their wares. So you can do a little Christmas shopping and help support our folks. We also partner with the South Carolina State Fair, and we have a table there every year where we pass out some information on their Disability Awareness Day. For some of our folks, hopefully you've heard about DDSN at our Autism Connect event. We have a promo video I won't bore you to tears with today, or maybe I will. And so I would love for you guys to attend if you have any questions about supportive services in the community for our individuals with an autism diagnosis. It is going to be held in April of 2025. We don't have a specific date yet, but pencil that in, April 2025. We have general contact information that I'm going to share with you guys. If you just have general questions, please feel free to call our main switchboard, 803-898-9600. We have a fax number too. Oh, Miriam's coloring on my picture. We do have a toll-free number. If you want to mail us a lovely letter, a beautiful picture, or whatever you want to send us, we do have a physical address on Hardin Street Extension. We will be moving to Casey sometime in 2025. So just keep that in mind. This is good as of right now. And we do have an online contact form at ddsn.sc.gov/contact. If you have loved ones that are between the ages of 14 and 26, and you're wondering, what does life look like after high school? I would recommend you take a screenshot or a picture of their post-secondary transition coordinators. They're in random counties all over the state. So Angela serves mostly the upstate region, Octavia's in more of the PD low country, Savannah and Carrie take more of the Midlands, with Carrie taking a lot of the low country as well. So these are individuals that help process with families, what does life look like after high school? Is that employment? Is that supportive independent living? Are there other services and supports maybe that we can turn on that the family hasn't thought about yet? So these are really great people to talk to and to pick their brain about what services and supports are available in your area. If you just want to chitter chat with me about all the services and supports that we have, my forte has been autism services. So usually I get emails from caregivers who are like, I have a 14-year-old with autism. We live in Richland County, and these are a couple of our problem behaviors or challenges that we're facing. And I can usually pop in a good number of resources that families haven't tapped into yet. So we do have quite a bit here in South Carolina, and I'm always happy to help with that. Thank you so much for tuning in and to learn a little bit more about DDSN and the wonderful state agency that we have here. I will go to the questions box.
Thank you, Stephanie. That was fantastic. I always appreciate hearing you present because I know I learn something new every time. So thank you. And it's a lot that the department is doing. And I think just creating some awareness around that is fantastic. So thank you for all you and your colleagues are doing over at DDSN. I did look through the chat and have a couple of questions that folks had along the way. So if you're good just to move through those, I will go through them as they came. So the first one was just about clarifying if someone is on Medicaid, let's say they are getting Medicaid services and they want to know kind of what is that different? How is that different than, services that they would receive at DDSN? So can you speak a little bit to that?
Sure. So Medicaid under EPSDT, which is probably too many acronyms for anybody, covers a lot of our services for children. It's like a state health insurance. And so what DDSN offers is an add-on service. So any of the services that DDSN covers can't legally be covered by Medicaid. So it does not duplicate. They're a whole other category of additional services and supports. So when you think of your typical like commercial health insurance, Blue Cross Blue Shield, Cigna, TRICARE, what have you, probably not TRICARE, they cover everything. But those other traditional commercial insurances, that's what Medicaid usually is designed to cover. So wellness checks, some durable medical equipment, therapies like speech, OT, ABA, that kind of stuff. We cover at DDSN additional supports and services to keep the individual in their home for as long as possible. So those companion services, those respite services to give their caregivers a break, those things aren't covered by Medicaid for the most part. They can't be because they're a waiver service. So if you're thinking you're getting everything from Medicaid that your individual will need for the rest of their life, then maybe DDSN isn't necessarily the waiver that you want to apply for. And that's fine. But for a lot of our folks, plugging in some of these services can keep them in their community and live as independently as possible for as long as possible.
Thanks, Stephanie. And I will add too, we have a waivers training that we'll be doing in the next couple of weeks, and they'll go into a little bit more detail. So that may help answer some of those questions. But you're right, a lot of times it's those services may be able to be provided. Some of that DME, that medical equipment can be provided under Medicaid. I know there's often questions about incontinence supplies that could be covered. So a lot of that is kind of already for many families, they can get that under their Medicaid services. But if they're looking for kind of what else is out there, talking certainly going through the eligibility process as well would be helpful.
Yeah, and adult type services. So incontinence supplies
Yes.
are covered for children, but
Yes.
not for adults under
Right.
Medicaid. So if they need lifelong incontinence supplies, then applying for the DDSN waiver would be helpful.
Perfect. Yeah, thinking about all ages and across not just what's needed now, but even to what's going to be potentially needed in the future.
Mhm, mhm.
Thank you. There was a question back earlier on about how to apply for respite. I know you spoke a little bit about that, but that's often a question.
Yeah, through your case manager. So if you're already DDSN eligible, your case manager or your early interventionist has to submit the respite request for you for us to review it, accept it, reimburse for it. That one thing. If you're not in with DDSN yet, or if you're in the process and so it hasn't been confirmed, there also is a resource called the South Carolina Respite Coalition that might be a good, gap filler in between.
That's great. And we do often refer families there because they're a wonderful support and resource, especially if families are waiting for services that way. Kind of back to the question we just talked about with Medicaid of like, can you receive services here and here? For families, this question is, can a family be receiving early intervention and not DDSN case management and receive waiver services? So how does early intervention then fit in?
All go together, right? Right. So it's unlikely that somebody will get a waiver slot while they still have early intervention. And you either have early intervention or a case manager, you don't have both. And so what usually happens is they have early intervention when they're young, they transition to case management, and while they have a case manager, they get a waiver slot. And so it kind of lines up pretty perfectly together.
Perfect. I know there was questions about the wait list and knowing that they vary by waiver, but can you talk a little bit about the waiver wait list as well?
Sure. So Haskell is going to be the shortest one to get into. I don't have an estimate for that. For our community supports and IDRD waiver, we estimate a 5 to 8 year wait list for those. That's why the supportive services in the meantime are key. We do have a special route for critical cases. Critical isn't because mom said so. Critical is like a doctor said so.
Great, thank you. That helps. Just so families know in terms of planning, and we always say the earlier the better. Go ahead and do
The
now.
earlier the better. Yeah.
Right. So for our families that have multiple kiddos and they're receiving services, this question is about 3 children that have autism. Do they each need separate case managers, or are they all having the same case manager?
My understanding is that is a conversation to be had with the case management company. So that really depends on like caseload size and availability. So that would be unique to each case manager organization.
So maybe a follow-up conversation to have with that case manager and ask and kind of see what's, like you said, capacity and if how to best meet the needs of each individual child.
Absolutely. Yeah.
Great. Okay, now of course several questions related to autism, and
Yay!
you're the one to certainly pose a question to. And Stephanie and I were also talking right before this, and said we definitely want to do an autism resource training early part of next year and have Stephanie come back and just focus on her division. But there were a couple questions related to autism screening. One about, you mentioned there were no wait lists in parts of the state. So could you repeat that about kind of where if families are interested in evaluation?
Sure. So anyone who calls the 1-800-289-7012 number and lives in either the upstate or the Midlands, you will be routed and needs an autism evaluation for as part of the eligibility process. You'll be routed to either of those two offices. And for those two offices, the Midlands and the upstate regions, we don't have a wait list right now. As soon as we determine that you need an autism evaluation, our scheduler is calling you are calling the family to complete one more questionnaire for us and put you on the books. We are scheduling in December and January at the last time I checked for people who can go through the process. The longest part of our process is the records request. So to make that as short as possible, when a family is calling the 1-800 number, have the medical records available. You're not sending them in right then when you're calling the 1-800 number, but that's the next step is they mail you, hey, fill out this questionnaire and send us a copy of the records. And if you already have those ready, it's much faster. We can get you in. We can tell from an IEP that the school evaluation was missing the ADOS, for example. We could call you within a week and schedule you. We're really excited about that. For anybody who lives in the PD or low country region and would be willing to travel to the Midlands or the upstates, you can get a faster evaluation as well.
Okay, thank you. That's helpful. I know that there were a couple questions just in terms of eligibility for the autism division. You know, how do we refer? Is it the same process? Are there age limits to go into the program? And especially too in like that transition from pediatric to adult care, how does that look? Is that different for families that are considering or looking for services for older use? So I realize that's several questions in one, but it was kind of all along the same, under the same umbrella of eligibility and receiving services at different ages.
Sure. So eligibility requirements, we have them established regardless of age. And so we have had people apply or EIs help individuals apply when they're 2. We also, adults, that's primarily our target audience. We don't have a cutoff for that. Just the eligibility criteria that I talked about before. Some disabilities have to be present before the age of 22. So that's important to have documented medically. But if they apply at age 23, that doesn't much matter to me. In the autism eligibility area, we have less stringent requirements for adults than we have for children. So that's something to keep in mind. So if you have a 30-year-old in your care and you're like, I can't get a copy of school records, I lost them somewhere 20 years ago or what have you, that's okay. Apply anyways. We'll work with you. We'll help fill in some gaps. Did I
That is
answer all those? I'm sorry.
Yeah, no, I think that's great. I was just thinking, as you were talking to just in some of the questions about navigating, it's, you know, certainly a lot of service navigation questions as well. And for those families that maybe haven't worked with Family Connection previously, or maybe haven't in a while, maybe you had a younger child and now you're at a different transition point. I did just drop our link to our online referral. Families can always self-refer. So some of these questions that maybe pop up of, you know, I'm having a difficult time, I don't know how to navigate this, or conversations to have with my case manager, or I think we've got, you know, what we need, but I just want to make sure we're not missing anything. Certainly Stephanie and DDSN are a fantastic resource. If they are general questions, like I said, and you want to give us a call, and our like Stephanie said, our Monday through Friday, 8:30 to 5, preferably not 4:59, but you leave a message, we'll call you back. I just dropped our 1-800 numbers in the chat as well. So if you have questions that you want to talk with one of our either family support specialists, our healthcare team, or ed specialists, we can connect with you that way and kind of help you navigate some of those services as well. And like, you know, Stephanie shared, she'll be putting her information. She's shared her information. We'll be sending it out in an email as well after. So I want to go back and just see kind of, oh, thank you. Okay, great. Putting that back up on, just see if there's any other questions. There was a clarifying question about case manager and the respite services. Is that particular DDSN case management, or could it be a case manager through Medicaid or MCO that puts in that request?
So there's a couple different respite options, which is why answering that question is difficult. So there is personal children's care aid, which is a respite option that's offered through Medicaid. Well, I wouldn't say every, that's a strong statement. To get family arranged respite funds, somebody would have to be DDSN eligible and they would have to have a case manager who's in our system. A lot of our case managers are DDSN and Medicaid case managers, so I haven't run into the issue yet where somebody's only Medicaid enrolled and can't submit a respite request to us in the DDSN system. But if a case manager has an issue with a respite request, they can reach out to me and I can direct them to the right person. We have a whole team like right in my hallway, steps away from me, that can help with that.
That'd be great, Stephanie. And I think that's it. It's just knowing who to get to ask those questions. And this may be another question too of like, who is the best person to kind of help answer these questions. But it's about on the IDRD waiver about a child being eligible for career prep. If you have a 20-year-old and that will graduate, is that different than voc rehab? How do those work together or different? Can you give any kind of insight into that as well?
If somebody wants that specific information, I would feel more comfortable directing them to Becky Peters, who is our Director of Day and Employment here at DDSN and Residential Services. She can give more concrete examples, especially if somebody's having trouble with the service, getting started, or whatever's going on, some challenges with that. Becky should be able to point them in the right direction to make sure they get the services. Becky's information, pull that up for you guys real quick.
Thanks, Stephanie. As you're pulling that up, I am going to drop, we'll get to a couple more questions I know folks may have, but I want to put the evaluation in the chat as well. So as folks, I know folks may have to hop off in just a few minutes, but before you leave, if you'll just take a few minutes and give us your feedback, certainly things that you'd like to see for future trainings. I'll just put that in as you're pulling up Becky's information.
Becky's information, her phone number is 803-898-9704. And she's a wonderful wealth of information. She's the director of our adult supports. So residential, day, employment, that kind of stuff. I will say she always talks about this wonderful program called Project Search. So that would be a question to ask the child's school if they are a Project Search participant and how they can be enrolled in that program.
Great. And sometimes I think it's just what are the questions to ask?
Right.
Just not that always knowing the answer, but kind of what do I need to ask? Because oftentimes it's just that can help get to the next step. I wanted to, I know we're getting to an end. There was a question and it made me think about providers and just of kind of how to find providers. I know y'all have, especially on the division's website, put out a listing of the database of how to find providers, just so families can be informed of kind of who's out there, in particular questions about like home care companies or, other providers that are, helping to serve families. Do you have any references or can share just a little bit about where families might find more information as they're looking for who's in my area, what do they provide, that sort of thing?
Sure. On our DDSN website, that's where we have a finder providers option, and you can pick by specific service type to see who your options are in that area. Your case manager is also a good wealth of information because sometimes families could be looking at the list and say, I don't recognize any of those names. I can't vouch for any of those. And so talking with somebody who is in this field and is familiar with these companies would be a good place to start. And usually that's going to be your case manager. Medicaid also has a really cool Find My Provider feature. So we talked about that a lot of services are covered by Medicaid. And then we have our own DDSN specific stuff, but you could go on either one of those websites and find some provider listings.
That's great. Thank you. I know that's really helpful that y'all provide that. And then too, that have those to kind of look at also what's on Medicaids as well.
We've also revamped our website recently, like in the past year or so. And so our autism division website has a laundry list of resources. If somebody's just, like you said, doesn't know what question to ask and just wants to see what's out there, we do have some additional autism resources for people to consider. Our post-secondary transition website for that 14 to 21 age range, they revamped their website and it's phenomenal. Has a lot of great information for, young adults or older youth in that age range as well. So go poke around our website.
Yes, I would say y'all do have a really, really good website and it's updated regularly. So that's helpful too, that I think every time even we go on and we're, looking for something or we'll find something new that's helpful, we'll be on there looking to send one family something and find something that 3 other families need. So, and I did just put I just put the link for y'all's website in the chat. I think in closing, a couple of things have definitely stood out. There's a lot of services that are available. Kind of what would be your takeaways? I guess for someone who doesn't know where to start, and then maybe someone who has started but isn't really sure kind of where they're at, whether it be on the waiver or like a question we had earlier about, I don't know who my case manager is, but I don't know where to start. So both a family who's kind of just starting and maybe a family that maybe just needs a little bit more. Do you have any 1 or 2 like pieces of guidance as we close out
Yeah.
today?
I would say don't wait. I would say it doesn't hurt to call our 1-800 number and apply for eligibility. You can go on an inactive status if there's no services and supports and you feel like the school's meeting your need and everybody's fine. But that way you can turn it on when you need to. We were talking earlier about hormones or when they age out of high school, what happens next. And you don't want to have your loved one age out of high school, you still need to continue to work. And you're like, who's going to watch them? And now you have to wait 5 to 8 years to get a waiver slot. Now you're 5 to 8 years behind. DDSN services are a supplemental service. You might not need it, but you, like I said, can meet eligibility criteria and just be in an inactive status and a just in case kind of thing. For anybody who doesn't know who their case manager is or doesn't know if they're already DDSN eligible, 1-800-289-7012 is the intake line that should be able to answer all those questions for you.
That is wonderful. Thank you, Stephanie. That's good. Kind of just kind of thinking about, all right, here's my 1 or 2 takeaways of what to do from today. So I would just kind of echo what Stephanie said. If you've got follow-up questions or you jump off of Zoom and you think of it 30 seconds later, you've got Stephanie's contact information. You have a Family Connections contact information, so you can reach out to us, give us a call. And at this point, expect to get an email from me and with the information that Stephanie so graciously shared with us today. So you'll get that in your email. And then in the next couple of days, we'll have a link to our website and our YouTube channel where a recording of this session will be available if you want to go back and give it another listen. So thank you so much, Stephanie, for being on. Thank you all for attending. Really appreciate your questions and your time. And stay tuned for another session we'll get planned early part of next year. I'm going to go a little bit deeper into autism services and support. So thank you all. Bye-bye.